Hi, and welcome to In Our Community. I'm your host, Erin Nelson. Today I have joining with me Dr. Graham Scott, who is a champion physician for hypertension here at Kaiser Permanente in Riverside. Welcome, doctor.
Thank you, Erin.
Let's have our viewers get to know you a little bit. Tell us how long you've been practicing and how long here in Riverside and Corona.
Erin, I've been practicing in the Corona office of Kaiser Permanente for 3 years, in fact since they opened, and I've been with Kaiser Permanente in Riverside for 10 years. I did my residency training here in Riverside as well, so I've been here quite a while.
I see. And tell me about where you're located right now. You're at Kaiser Permanente, and you also have an office in Corona?
Currently I'm affiliated with, I work with Kaiser Permanente. I'm affiliated with the hospital in Riverside, but my main office is at the medical office building in Corona.
Okay. And today we're going to be talking about hypertension, and we know it as commonly called the silent killer, or some might call it that. Tell us a little bit about what is hypertension exactly.
Okay, Erin, hypertension is the most common chronic disease in adults in the United States of America. In fact, 29% of all adults have hypertension, and when you think about that, that's 1 in 4 people. It's a lot of people. Untreated hypertension puts you at very great risk for heart failure, heart attacks, and kidney disease. And the thing about hypertension is that it doesn't have any symptoms, and because of that, it's become known as the silent killer.
I see, and it's related to high blood pressure, correct?
Yeah, it's the high blood pressure which leads to the diseases which which are quite serious.
Right, and what is the definition of high blood pressure?
Well, let me start by telling you what blood pressure is. Blood pressure is the force exerted on the inside of the artery walls by the blood as it's pumped around the body by the heart. And we measure blood pressure with 2 numbers. The first is the systolic, or the top number, and that's a measure taken when the heart is beating. During beats, the heart relaxes, the blood pressure goes down a little, and we have a lower number called the diastolic number. So for example, if I had to measure your blood pressure today, I'd get a number, hopefully a normal number, of 120/80, for example, and that would be 120 systolic over 80 diastolic. Measuring blood pressure has traditionally been done with a mercury sphygmomanometer, which is quite a difficult word to pronounce. And in fact, that was the winning word in the National Spelling Bee just 2 weeks ago.
Was it really?
Absolutely.
Wow.
Yeah, don't ask me to spell it, though.
I don't think I could get it either. So.
Now, we used to use mercury for blood pressure machines, and we don't do that anymore because mercury is quite toxic. We're trying to remove it from the community. But we still, interestingly enough, use millimeters of mercury as our measure of blood pressure. You wanted me to tell you a little bit about what hypertension is as well. And
right, yes.
Yeah. Hypertension is a disease process that comes about when you have persistently abnormally elevated blood pressure. And we define hypertension as blood pressure that's above 140/90. However, in patients with diabetes or kidney disease, because they have other risk factors other than diabetes, we like to define their normal blood pressure at a lower level. So they need to have blood pressure below 130/80 in order to be normal.
Right. And why do we get hypertension?
Well, it's quite interesting. We don't really know. 95% of people with high blood pressure, we can't pinpoint why they get high blood pressure. And we diagnose those folks as having essential hypertension. There's some theories about it. We believe that it's a complex interaction between genetics and environment. It has to do with the body's ability to control salt and water balance, with the body's ability to control the force that the heart contracts, and the body's ability to control the diameter of arteries throughout the circulation. And in fact, at the end of the day, it's probably a combination of all of these factors.
Really?
Interestingly enough, there's also a 5% group of people who have what we call secondary hypertension. And these are folks who have a identifiable medical cause for their high blood pressure. For example, narrowing of an artery to the kidney would cause a disease called renal artery stenosis, which would end up with hypertension. Certain kidney diseases can cause hypertension. A common disease that we see nowadays is something called sleep apnea, which is where patients have a tendency to stop breathing for short periods of time while they're asleep. Those folks often have high blood pressure.
And that can be an effect of, you said sleep apnea. Is that?
Well, sleep apnea can result in high blood pressure. And interestingly enough, if you treat the sleep apnea, the blood pressure tends to become normal again.
Wow.
So that's quite interesting.
That is.
Yeah.
Well, let's take a break, and then when we come back, we'll kind of talk a little bit more about hypertension and let our viewers get to know more about how they can be aware of this. So, all right, we'll be right back.
This is my friend Rodney. This is my friend Rodney on heroin. This is Rodney on heroin. Rodney on heroin. Rodney on heroin. Rodney on heroin. Rodney. That was my friend Rodney.
Welcome back to In Our Community. I'm your host, Erin Nelson, and today I have joining with me Dr. Graham Scott, who is a champion physician for hypertension here at Kaiser Permanente in Riverside. Welcome back, Doctor.
Thanks, Sarah.
And we were talking about why people get hypertension, and you were talking about sleep apnea. What kind of damage can hypertension do to the body?
Erin, hypertension or persistently abnormally elevated blood pressure over a long period of time primarily damages the inside of the blood vessels. That constant force on the inside of the blood vessels causes microscopic injuries on the inside of the blood vessels, which heal up with scarring. And that scarring results in hardening of the arteries, which leads to an increased susceptibility to strokes. It can cause some kidney damage, and it also damages the retina, which is the back layer of the eye. In addition to that, hardening of the arteries can accelerate the process of atherosclerosis. Now, atherosclerosis is that process where you get cholesterol plaque build up on the inside of the arteries, and accelerated atherosclerosis because of hypertension leads to premature heart attacks.
Wow.
One of the more serious consequences of hypertension is if your heart's been beating against this high blood pressure for many years, the heart enlarges initially and eventually it starts becoming weakened, and eventually the heart can go into heart failure. And the interesting thing, if we look at the numbers of people who get affected by hypertension, the risk of getting heart failure, if you have hypertension that's untreated, is as high as 60%. The risk of having a stroke is as high as 42% if you haven't, if you've neglected to treat your high blood pressure over many years. And the risk of a heart attack can be as high as 44%. So there's significant risk involved in this disease.
Wow. And people who have hypertension, we know that it's important to keep our blood pressure in check. What is something that people can do, or what are some of the symptoms that somebody might have of hypertension?
Well, that's a good question. The symptoms of hypertension, I usually tell my patients that the problem with hypertension is that the only symptom you see is the stroke that you're having. So on a day-to-day basis, folks with high blood pressure usually don't have symptoms. And that's why we ended up calling it the silent killer.
Wow. So people only really know about it if they go and have their blood pressure checked.
Absolutely.
Right.
Yeah.
And then how many people often come in and see you that have hypertension after they've maybe haven't had a stroke yet or anything, and you've caught it? How long do people possibly have hypertension before they catch it?
Well, the interesting thing about that is that as I mentioned previously, 29% of the American population have hypertension, and that amounts to about 58 million people nationwide. That's a lot of people.
That is.
If your blood pressure is normal by the time you're aged 50, your chances of getting hypertension by the time you're 80 is about 90%. So ultimately, most of us end up with high blood pressure. So it is important to monitor and keep track of that. In terms of treatment, you know, there's a lot of really good therapy available with for hypertension, and despite that, only 58% of people who have high blood pressure are on treatment, and only 31%, that's only a third of them, are under control.
Right.
So unfortunately, it's a condition that's been somewhat neglected over the years.
Right. And so there's a lot of people out there with hypertension, whether they know it or not.
Absolutely, yeah.
Wow. I do want to go back to some of the causes of hypertension. Can you pinpoint some of the causes so that our viewers know exactly how they might develop hypertension?
Yeah, as I mentioned previously, Erin, there's a large group of folks who have what we call essential hypertension. We really don't know the cause, but we know what puts people at risk for developing essential hypertension. And it's important to know if you're at risk, because then you can take measures to try and prevent yourself from getting hypertension. And folks who are at risk are people with a family history. If your parents have had hypertension, or a brother or a sister, you need to be aware of that.
Now, let me interrupt you real quick.
Yeah.
Does that mean high blood pressure? If a high blood pressure runs in your family, is there a possibility of hypertension then running in your family as well?
Absolutely. If your parents or a family member has been diagnosed with hypertension or high blood pressure, then there is an increased chance of you developing that, because we
Right.
know there is some genetic influence in who gets hypertension and who doesn't.
Okay.
Other groups that are at risk for hypertension are folks who are overweight, folks who have a sedentary lifestyle, people who don't get out there and work out every day, those that like the typical high sodium diet, a low potassium diet, people who don't like their fruit and veggies, puts you at a slight risk of increased blood pressure. And then excessive alcohol intake, that pushes your blood pressure up as well. And then there's a group of people, when we look at the definition of high blood pressure, we like to define blood pressure according to what's normal and what's abnormal. And blood pressure is defined by a large group of experts who call themselves JNC, which stands for the Joint National Commission on Hypertension. And they've defined normal blood pressure as being anything below 120/80. Anything between 120 and 140/80 to 90 is regarded as pre-hypertension. So it's someone who's at risk of getting hypertension. And so back to your previous question, folks who have blood pressure in that range from 120 to 180/80 to 90 should be aware of that and should be taking some measures to prevent the hypertension.
Right. And as far as people in our community and percentages, how many did you say have hypertension or high blood pressure?
Well, it's 29% of the adult population, which is about 1 in 4. So
then if people were watching what they ate and kind of knew some of the steps that they could take to reduce, then they could be, better off having.
Absolutely. We could pick up the
lower their
condition a
blood
lot
pressure.
earlier, and we could there's a lot of things that folks could do to try and prevent themselves from becoming hypertensive. Maybe I can tell you some of the things that people can do to prevent that.
That would be great. Let's go ahead and talk about some of the treatments for hypertension.
Okay. Well, treating hypertension is, firstly, the good news about treating hypertension is that it is treatable. You can control your high blood pressure. And we start, typically, the most important part of treatment is education, learning about blood pressure, learning what you can do and how to handle it. And we talk about therapeutic lifestyle interventions, which means getting people to change their lifestyles to improve their health. Doing things like, definitely if you smoke, you want to consider stopping smoking. Cutting down alcohol consumption to about 1 gram per day for males and about half of that for females. Cutting down the sodium in your diet. Getting a diet, we call it the DASH diet, which stands for Dietary Approaches to Stopping Hypertension. And a DASH diet includes a diet with a lot of fruit and vegetables and nuts, lots of chicken and fish, low on meat. And the objective of the DASH diet is to try and reduce sodium, increase calcium, and increase potassium, all of which contribute to helping to control high blood pressure.
Okay. And you talked about there's no symptoms for hypertension. How do people know, just if they come in and get a checkup? So how would I know if I had hypertension?
Well, it's very simple. Firstly, it's important to know that there are no symptoms. The way you find out if you have high blood pressure or not is you have your blood pressure measured. And it's a very simple test. It's a blood pressure cuff that goes over your arm, squeezes your arm, and then measures the pressure in the arm. It's completely painless, it's quick. My suggestion is that folks get their blood pressure checked about once a year. And you can do it, there's a variety of places you can do it. A lot of the markets have blood pressure machines, and these are reasonably accurate. I would definitely make sure that you get your blood pressure checked every time you go to the doctor. And if your numbers are looking as if they're a little high, you should probably have it checked again. And if they're high more than twice, definitely go and get to see your doctor.
Now, I know that there are some testers on the market that you can take home and use at home on your own. Are those as effective or as accurate as the ones if you went to a doctor and had your blood pressure checked?
Absolutely. Most of those machines are very good. The technology behind them has advanced quite rapidly recently. There are certain brands that are perhaps better than others. My recommendation, though, is to try and avoid the ones that measure blood pressure on your fingertip or on the wrist. Mostly the standard for measuring blood pressure is to use a cuff on your arm.
On your arm.
And the electronic ones are nice because they're easy to do. You just push a button and it gives you a good readout.
Right.
And we definitely encourage our patients to get their own machines and to measure their blood pressure at home. In fact, in Kaiser Permanente, we have what we call the blood pressure loaner cuff system, where folks can come into us and actually take out a cuff the way you would take out a library book and borrow it for a while until they get their blood pressure under control.
Oh, really?
Yeah.
Well, that's an interesting fact. All right. Well, I think we're going to take another break right now, and when we come back, we'll just pick up right where we left off.
Good.
We'll be right back.
You might take meth because of how it feels. But this is how it feels to your heart. The only difference is you can't rebuild a heart.
Welcome back. Well, we're going to get back into what we were talking about with hypertension. And let's say I've been diagnosed with hypertension. Now what do I do?
Okay. Hopefully you'll never be diagnosed with hypertension.
I hope not.
But the good news is that hypertension is controllable.
Okay.
It does take some effort on the part of the person who's been diagnosed with hypertension, and we mentioned in the previous segment some of the therapeutic lifestyle changes that are important to consider making, like weight loss, stopping smoking, those kinds of things. Now, I also mentioned JNC7, which is that group that gives us a definition of what hypertension is. They also give us some guidelines as to how to treat hypertension, and they divided hypertension into stage 1 and stage 2. Because you treat stage 1 and stage 2 differently.
Right, okay.
Stage 1 is any blood pressure between 140/90 to 159/100. And the idea is that we treat stage 1 hypertension with therapeutic lifestyle changes as well as a single blood pressure medication. Once you come in with stage 2 hypertension, we usually go straight, and stage 2, by the way, is above 160/100. Once you're at that point, we usually go straight ahead and start you on 2 different medications. And the reason we do that is because studies have shown that almost as many as 60% of people with stage 2 hypertension eventually end up on 2 medications anyway. Wow. And so we just go ahead and start you on the 2 and get on with it, you know.
Now, stage 1 and stage 2, a person with stage 2 hypertension, would they have stage 2 because they went so long without seeking treatment? Or can a person who's in stage 1 and bump up to stage 2?
Probably both.
Either one?
Yeah. You know, if you had to look at the continuum of the disease process, it starts with normal, moves on to pre-hypertension, and then it usually goes on to stage 1 and then stage 2. And we all move through that continuum at a different rate. The reason it's important to know that is because if you're at pre-hypertension, if you're not quite stage 1 yet, you're at risk of becoming hypertensive, and you need to start doing the lifestyle changes to try and prevent yourself from getting there. So, you know, to answer that question, yes, you can move from one to the other. And those folks that come in already at stage 2, usually it's been because they haven't been aware of their blood pressure, and they've kind of moved from pre-hypertension to hypertension without being aware of it.
Oh, okay. All right. What other treatments can be available?
Well, Aaron, there's a lot of medications on the market now for treating hypertension. In fact, there's a whole huge industry that's developed around treatment of hypertension. And from a medical point of view, there are 5 or 6 different groups of medicines that doctors would typically use for treating hypertension. But I think there's 4 important ones that are worth talking about today. The first one is a medication called a thiazide diuretic. And typically, viewers out there will know their thiazide by names like hydrochlorothiazide or chlorthalidone or Maxide. This is a medication, it's an effective medication, it's a very safe medication, and it's frequently recommended as the first medication to put someone on when they get diagnosed with high blood pressure. Side effects of this medication are a slight increase in urine output, but that soon goes away, and once people are used to that, they tolerate the medication very well. So that's the most commonly used medication to treat hypertension. Second medication that's quite important is a medication type called the ACE inhibitors, and I won't go into detail about how it works, but it's often given to patients in addition to the previous one I mentioned, the thiazide diuretic.
Right.
The idea being that 2 medications are more effective than 1. Common names for ACE inhibitors that our viewers will recognize are Prinavil, Capitan, Zestril, Acupril. One of the side effects of ACE inhibitors is a slightly irritating cough, and if people develop that cough, they should probably talk to their doctor about it. But most folks tolerate this medication really well. Erin, if patients come to see us and they're on 2 medications and their blood pressure is still not under control, then we usually go ahead and we add a 3rd medication. And even that's not that uncommon. We're very aware of the fact that some folks with hypertension often need 3, 4, and even 5 medications to bring their blood pressure under control. So although it seems like a lot of pills, often that's what's required to achieve our goals. Yeah. The 3rd medication that we commonly use is something called a beta blocker. And common names that folks will hear are tenormin, Lopressor, Inderol. And beta blockers work, they bring blood pressure down by slowing down the heart rate. So people will often come to, they'll check their pulse while they're on these medications, and they'll find that the pulse is a little slower on these medications than otherwise, and that's not a problem. That's generally how the medication works.
Right.
And then the 4th one that we commonly use is from a group of pills of medications called the calcium channel blockers. And these, the names that you'll see are Adalat, Procardia, and Calan. These are very good medications, but we usually save them for folks where the other 3 medications aren't working. And one of the rare side effects of this medication is some swelling in the legs. So if a patient's on that medication, the doctor would probably be aware of that and keep an eye out for that.
In some occasions, is there a surgical procedure that would help, or that a patient might have to take to the next step? Have there ever been any surgical procedures to follow up?
Not really. If again, go back to the causes of hypertension. Most folks, 95% of folks, have essential hypertension. There's no real surgical cause for that hypertension. There's nothing you can really go into the body and fix with an operation.
Right.
There are 1 or 2 conditions in the group that are called secondary hypertension, where surgery can fix them. For example, there's a condition called a pheochromocytoma, which is a tumor that grows in the adrenal gland and secretes too much of hormones that make blood pressure go up. And the only way you can fix that is with surgery. The other one is narrowing of the kidney artery, renal artery stenosis. Sometimes opening up that artery and letting the blood flow through there better can fix the blood pressure. But as I said, that's in a very, very small minority of patients.
Right.
Most folks, it's medical management and lifestyle changes.
And prescriptions, that just changes something.
Absolutely, yeah.
Okay.
Yeah.
All right. And once on medication, you talked a little bit about lifestyle change, medications. What else? Anything else that can be taken, an extra precaution?
Well, once you're on medication and you're doing the therapeutic lifestyle changes that I mentioned, it's important to know that your blood pressure is indeed under control. And here in Kaiser, we have started a campaign called the Know Your Goal campaign. We were trying to teach our patients to know what their goal is so that they can become involved in their therapy. And just to reiterate, the goal is to get your blood pressure below 140/90 or 130/80 if you're diabetic or have kidney disease. So it's important to know your goal and to make sure that you're attaining that goal by checking your blood pressure from time to time. And I recommend the investment of buying a blood pressure cuff. It's really a worthwhile thing to do. The therapeutic lifestyle changes need to continue. They're not just a once-off. Those become lifestyle changes for the rest of your life. It's important to be very good about taking your medications regularly. And then it's important to get an annual follow-up to make sure your doctor is able to stay in touch with you.
Okay, and I have one quick question before we go to a break. If a person's on medication, can they, after they get their blood pressure under control, can they stop taking medication after so long, or is it something they have to be on for the rest of their life?
That's a good question. It's a question that patients often ask me, because no one really wants to be on medication for the rest of their lives. But the truth is that typically most folks need to be on the medication for the rest of their lives. And the reason being is that high blood pressure has a lot of risk factors, significant risk factors, and I think that it's a small price to pay for avoiding some really serious diseases. And so, if you put it into perspective, taking a pill every day for the rest of your life is really not that bad of a thing.
Okay. All right. Well, when we come back, we're going to follow up on how you can reach Dr. Scott. So we'll be back right after this.
Just hanging on the court playing b-ball when these drugged up bugs came out from behind the wall. They said,
"You're no good. We're the best in this neighborhood."
with no delay, the game got underway. The drugged up bugs were too high to play. They couldn't even hold a ball. Couldn't pass, couldn't shoot, couldn't score at all. Couldn't find the paint. In school they thought they was cool, but now they ain't. That's the buzzer. Time to quit. Home B's 100. Drug bugs zip. The lesson here is so plain to see. Drug free is the way to be.
Welcome back. Dr. Scott, what is Kaiser Permanente doing to combat hypertension?
Well, Erin, we are very aware of hypertension in Kaiser Permanente because we understand that the impact that it has on the community that we serve. And we know that almost to the last patient, how many folks we have that have hypertension. The mainstay of our program here in Riverside and in Corona has been education. We've been educating our medical assistants and our nurses in the correct technique to get accurate blood pressure measurements. We've been educating them in our Know the Goal campaign, which I mentioned earlier, where we want all our nursing staff and everyone to know what the goals of therapy should be so that if patients ask them, they'll be able to give them some worthwhile information. Physician education has been an important part of our campaign here, and we've had guest speakers and local experts have come and given us lectures on hypertension. And the interesting thing about our approach is that we've moved it beyond adult primary care. We've asked our specialists to be aware of hypertension as well, because they're a good place to find patients with hypertension and refer them for therapy. In terms of patient education, I mentioned the Know Your Goal campaign so that our patients can know what their therapeutic goals would be. We put an article in our local Kaiser Permanente newsletter, and we've developed a patient hypertension hotline for our members, and the number will be on the bottom of the screen, where folks can call in, find out what they need to know about hypertension, and they can also find out where to get a loaner blood pressure cuff and where to purchase their own blood pressure cuffs.
Right.
And then, Erin, in addition to that, in order to help the physicians look after all these patients with hypertension, we've developed what we've called the Population Care Nurses Clinic, where we have some very dedicated nurses working with us, checking for people's blood pressure, helping us adjust medication, helping make sure that patients get their labs done on time. And that's been in place since about February now, and that's turning out to be a very effective way of looking after all these people.
Right. Sounds great to be able to reach our community.
Right.
And what are some questions that most of your patients ask you, or what are some of the most popular questions that you're receiving from patients about hypertension?
There's a lot of questions and that people ask, and the important thing to realize is that when we diagnose hypertension, we're asking people to go on medication for the rest of their lives. And so the question that you already asked me about whether whether they need to be on this for the rest of their life is the most common question, and the answer is again yes, they probably do. But a common one is the idea that if you get that diastolic, the lower of the two numbers, under control, then you're going to be okay. A lot of folks come in and they say, well, my blood pressure was 80 over 160 over 80. As long as the 80 is good, I'm okay. And the truth to that is that years ago we used to believe that diastolic blood pressure was important. But we know now, after doing lots of large studies, that it's actually the systolic, the upper number, that's important. And we know that treating the upper number, making sure that that upper number comes down, usually the bottom number follows on its own. So the message from that is it's not the lower number, it's the upper number that's important.
Okay.
And then another question that folks often ask is, we call it hypertension, and they start wondering, is it because my life is full of tension and stress? And the truth is that, stress and tension and being stuck on the 91 will push your blood pressure up, like it will do to anyone. Yeah, you'd agree with that one, I'm sure. But no one's really ever proven that a stressful, tension-filled life actually causes hypertension. It can certainly contribute to it and can make it harder to treat. And it certainly, we advise our patients to see if they can reduce the stresses in their life. But it's not the cause of hypertension per se.
Okay. Great information. How can our viewers get a hold of you or reach you?
Well, for Kaiser members, we have the hypertension hotline. And I would encourage them to use that. Lots of useful information available there. And obviously, I think if you do have questions about hypertension, it's very important to get in touch with your doctor make sure that you understand that you're, feel comfortable about your blood pressure.
Right. Okay. And the message you'd like to leave our viewers regarding hypertension?
Well, the most important thing about hypertension is that it's extremely common. 1 in 4 of you out there have got hypertension, and at the moment we're not treating hypertension very well. The way that I'd like to see people improve the therapy for hypertension is get your blood pressure checked. About once a year is good, and if it's elevated, make sure you get in touch with someone in the medical profession.
All right. Well, you heard it straight from the doctor. Make sure you have your blood pressure checked and that you are not a candidate for hypertension. Well, thank you very much, doctor, for meeting with us and telling us and educating us about hypertension.
You're welcome, Erin.
All
Thank
right.
you very much.
Thank you. Thanks for tuning in. We'll see you next time.